Welcome to Founders Future, a podcast powered by Closers.io, where we dive into the journeys of innovative entrepreneurs and explore the road ahead for them and their companies. I'm your host, Ammar, and in each episode, we uncover the stories behind impactful ventures, the challenges faced along the way, and the strategies driving their future growth. Today, we are absolutely thrilled to be joined by Liza Nicholson, founder and CEO of Avail Management Services, a healthcare consulting firm dedicated to transforming the quality, efficiency, and accessibility of healthcare delivery for organizations of all sizes. With a mission to innovate, educate, and empower, Liza leads a diverse team at Avail, helping hospitals, government agencies, and community providers implement meaningful change for patients and staff. Liza, welcome to Founders Future.
Thank you for having me.
I am excited to dive in. I always like to start from the beginning. So take me on a little trip down memory lane to before you started Avail. What were you doing at the time? And then what was really the motivation behind starting the company?
Thank you for that. So I've worked in healthcare about 12 years before starting Avail, working indirectly with healthcare organizations, hospitals, and also in case management. So working with healthcare leaders on a regular basis. And I started to see some of their challenges, some of their aches, things that was keeping them up at night. And so moving forward, I thought, what are some ways, some things that I can do based on my current knowledge and expertise to help these organizations flow a little bit better when it comes to efficiency, looking at their revenue, what comes in, how that comes in, looking at workflow of their teams, ensuring that they're utilizing their, whether it's healthcare teams or assistants, using them at the top of their licenses to ensure that if a patient comes into their organization, they have the best experience from the very beginning to the point when they walk out the door. So I started to notice more and more gaps when it comes to physician offices, hospitals, health systems, nonprofit organizations. And so I started to dig a little deeper and to see how I could help these organizations. And that is how Avail Management Services started in 2019. And we have been just moving forward and growing ever since.
I love that. That's powerful. So you started in 2019. I'm curious, what were some, or did you have any challenges at the beginning, specifically challenges around starting the business? Whether you should do it, whether you shouldn't do it, going back and forth in your mind. I was wondering, I'm curious if any of that happened to you.
Yeah, so I want to say about 6 months prior to actually starting, I knew I wanted to do it, right? But I am a planner. So I had to ensure I had a business plan, ensure I had the financial backing behind it before just pushing it out there. So I
Yeah.
also dabbled a bit around the name. I knew I wanted to go from being a solo healthcare consultant to a firm-based consulting agency. So I thought about, okay, I want the name to be something that stands out to people and that they remember, because the goal is for us to be a global entity that is helping organizations across the world. So this needs to be
Mm,
something that people will always remember and it becomes a household name.
I
Went
love
back
that.
and forth there a little bit, and I did decide on Avail Management because it actually encompasses both of I have two daughters, and it encompasses both of their names, right? This is a legacy. This is not something that was planned to be around for 5 years and then fizzle out. It was something that is planning to be here for as long as they are here. So got the name in place, really defined the plan, really ensure that I had the tools that I needed to get started. And that took a lot of research, market research, seeing what trends were out there. And we pride ourselves on innovation. So I knew that was going to be something that we held true to. So
Mm,
getting those things in place, and then about 6 months later, it actually came to fruition. And we had to start that. It was like any other new business, right? People, they haven't heard your name before. They're a little bit hesitant, but I was fortunate because I'd worked with a number of organizations just currently where they knew who I was. And so if it was like, we may not know what Avail Management Services is, but we know Liza Nicholson. And
Yeah.
so in that, they were more open to coming on board, hearing what services that we could offer them, and then also knowing the reputation I had for success, being able to talk through that. They talk about different projects that I worked with that have been really successful over the last 10 to 12 years. And that resonated with them. And so they were more likely to hear what we were talking about as a firm at this point.
Cool, cool, very cool. Let's dive into today to give the listeners more context into what Avail looks like. Let's
Mhm.
start off with who is your ideal customer, and then from there we can dive into the different offers and services.
Yes. So the ideal customer target person or people for Avail right now would be healthcare leaders, your chief executive officers of nonprofit organizations, for-profit hospitals and health systems. We do meet occasionally with the CFOs of organizations, but we start with that administrator, CEO of the organization. Those are the decision makers that we target.
Got it. Got it. Administrators, those are the first people. Those are
Mhm.
the people that you target within the organizations. Now,
Yes.
when you're coming in to work with these healthcare facilities, what are the core offerings? What does that actually look like to work with Avail?
Yes. We typically open up talking about efficiency. How can we help your organization be more efficient in every aspect? And
Mm,
so a large part of that is program management and project management. We do grants management as well for organizations that have grants. For those that have just a budget around programs, we work with them. And then we also do work around, which we don't market this as much, around recruiting and helping them to get an efficient team in place to be able to meet the needs of their patients, of their programs that they're currently working with.
got it. Very cool. Is there a typical client engagement? Like, for example, typically you're working with people for 3 months, 6 months.
Mhm.
Is there anything like that?
So there isn't really anything typical or standard. It looks differently for every organization we work with. And that is something that we pride ourselves on, is being able to customize our
Mm,
management tools for the
yeah,
actual organization. So a health system's scope of work would look completely different than a nonprofit organization that has 10 employees working there. So we do tailor to meet the needs. We typically start off by assessing their needs, right? Once they either make contact with us or we make contact with them, we assess to see what can we help them with? How can we help them? And believe it or not, there are times when they'll come to us with what they have identified as a problem. Once we assess them and their readiness to change, they actually have four other problems that they need addressed. And we have the ability to lay that out for them and realize after talking to that leader a little bit more, there are some specific things that they may need addressed. And it may be we have a program that we recently got $5 million for, but we currently don't have anyone to run the program. And so they'll look at us to do that. But
yeah,
in doing that, they may realize they need a front office person that can help with some things. And so we will help them like tailor a job description. We will help them market it and get that person in place as well before we start program implementation for their
got it.
project.
Very cool. So it's very customized depending on the
The
scope of
need.
work. Walk me through when it comes to acquiring customers, when you're looking to bring on more clients to your consulting firm, what are you currently doing on a lead generation and marketing front?
Yes. So we've been really fortunate. A lot of the current clients we have come through previous clients or current clients that we're working with. It'll be these healthcare leaders may be at a conference or they may be at a meeting with other leaders and they'll say, who's writing your grants or reviewing your grants or who's running your data reports? And Avail Management Services, the name has come up. And so then they'll reach out to us and we'll just assess their needs and start to work with them. So we've been really fortunate to utilize our current client testimonials. That has been a marketing strategy. We've also utilized social media ads. We've done a commercial. We've had our information just put into the newsletters of current clients. And so when that information is going out to their listserv, which may be 2,000 people or more, they're able to hear about the work that we're doing. So we've been fortunate in that, but we are looking, and 2025 has been our year of enhancing our marketing. We've recently brought on an executive advisor for business development. And so we're super excited to see the plan that he's working on to help us market even more. So our services, people are aware more of what we do, how we do it, and how we can potentially help them.
Got it. Got it. Very cool. So it sounds like to me the biggest drivers are referrals, past clients. I'm curious your perspective on this because late last week I was having a conversation with another high-level consultant, and he was talking about referrals, word of mouth networking, but those are his main drivers. He also expressed frustrations because typically with those channels, there can be inconsistencies, unpredictability, because it's hard to pull a lever and get more referrals, right? I'm curious for you, when it comes to building more predictable lead gen in place, what challenges have you experienced with that? And maybe what future initiatives do you have planned to build more of that predictability?
Yeah, we haven't had a lot of inconsistencies with that area. And I'll say this, and I can't speak to different organizations. I get that it looks differently. The industry looks differently sometimes. But something that we've been able to really build on is that once the referral comes in, it's actually a warm handoff as well. So what we've learned is that specifically working with physicians and specific healthcare leaders, they want to work with someone that has worked with someone they know. That's been the challenge of if they didn't know of us, it was hard to get in the door. But if they were referred by someone they knew and respected, they were more likely to reach out to us. And then at that point is where we're able to know what services we can offer them, what challenges identify, what challenges they may have, and then help them create a plan that may be 2 years out as to how that could be addressed and how we can help. So that's been a large part for us, and it honestly has been working really well. We're just, of course, trying to grow, so we're looking at what our marketing could do for us even more.
Okay, got it. So when you think about growth and you think about expansion and moving beyond referrals, obviously that's something that's already going to be there.
Yeah.
But when it comes to moving beyond that to expand even further, w- what do you think is the next step? What do you think is the next evolution to bring in more clients?
Yes, it's going to, for us, part of that plan is going to be meeting these healthcare leaders where they are. Okay. That doesn't look like cold calling. I'm not against it. It happens, but that's not a strategy we have in place for the next couple of years. Our goal is being in spaces where these healthcare leaders are and talking to them face to face, opening that conversation up when we're seeing them. So that may be at healthcare leaders conferences, that may be at specific meetings that they're in, that we reach out to the facilitator of those meetings and make sure we get on the agenda so they're able to hear about our services in a capacity where it may be 500 leaders all in one space. It's a lot easier, we found, to be in those spaces where we can touch a lot of those leaders at one time and talk about our services versus the one-on-one and versus the referrals. So that gets us in front of our target audience. That gets us where we're able to share what our core offerings are in one place where it is the messaging is consistent. And then, believe it or not, from that point, the calls and the emails start to come in. Honestly, a couple weeks later, we've seen that where we've went and we have presented to a healthcare leaders group. And that encompassed stateside leaders as well as international leaders that were there. And so they've been reaching out to say, okay, we heard you mention this specific service. This is what we need. And so then we start to filter out who we can help, what that can look like. And we've had clients that we've picked up for sure by that area.
Okay, very cool. I'm curious if you've thought about implementing any sort of digital marketing, digital advertisements, paid ads online. Have you thought about that?
We have done that before. We have done
Okay.
commercials before where it was showing up, what times of the day those commercials showed up. And in full transparency, we didn't really hit the numbers that I wanted to hit there because we started to then look at our target audience, which was those healthcare leaders. And we looked at what does their day-to-day look like and do they watch a lot of TV commercials? That was
Yeah.
something. And honestly, that answer was no. It was very low that our target audience actually watched a lot of TV or even listened to a lot of radio ads.
You ever thought about doing like Facebook or Google or something like that?
Yes, we have done Facebook ads before a couple of years ago. And that was pretty good. That reached a lot of individuals and organizations. So that was good. And that is something that we will probably look at again
Mm,
because now with that integration between Facebook and Instagram, where if it displays on one platform, it automatically displays on the other. So that is something that will stay within reach for us. What we also do, and we may get to this a little later, is that we work with universities throughout the US and globally. We work with research universities as well as those that are non-research, and we contract with some of their schools of public health. And we also now bring on almost in a lifting as we climb aspect, where not only are we working with for-profit and nonprofit, we work with students. If a student needs a public health practicum or an applied practice experience, almost like an internship, then I'll bring them under Avail Management Services and allow them to work out their hours to get credit, school credit for that. And now what we're doing is building a younger team that is able to assist us with digital marketing a little bit better. And so that's been
mm,
amazing to see these young people who are eager, who are wanting to be in that space of healthcare and public health. And I allow them to shadow the work that I do, as well as some of our consultants. And believe it or not, that is an indirect marketing tool because when they know what we do and they've worked with us, they either want to continue to work with us as consultants once they get their degree, or they also take that information back into the markets they're in and share about the work that we do. And so we've done conferences for schools before where we will go and work with those colleges and universities as well.
very cool. So it sounds like the next evolution when it comes to growth and marketing, essentially to acquire more customers, is dialing in the digital piece. Is that
Yes.
accurate?
Yes.
Cool.
And we created a hashtag for 2025, enhancing is dubbed KDIB. Okay. The K is for knowledge, enhancing the knowledge of all of our consultants and our leadership team. The D is for digital health and innovation.
Yeah.
Being more impactful is the I with our innovation. And then the B was our branding. It's where we look at that marketing and ensuring that our branding is consistent, that we're getting it out there more, we're pushing it. And whether that is through social media or ads, the goal is to enhance all of that for 2025 as we move forward. So that's been our internal team's goal. Hashtag KDIB.
I love that. Let's dive a little bit into the sales process side. So once a lead does come in through the door, what are the different steps that they go through for them to become a client? And are you the one that's leading? Is it founder-led sales essentially?
Yeah, I am still on the forefront of that. The new executive advisor we've hired is going to be taking a lot of those reins, but as of right now, I am still very much at the forefront of that. A client comes in, again, they reach out to us or we've reached out to them. We assess to see what their needs are. And what that looks like before services can get started or they become a client is that we look at and I develop a scope of work. And that's based on the assessment to see what they need and how we can address that. That scope of work is reviewed, of course, by that healthcare leader and myself. We then look at a length of the contract, and we typically don't take on any contracts less than a year. A year is pretty much the minimum. Now, we have been flexible for some organizations that did not have the financial backing where we may have been helping them to get financials. But typically, a year is the minimum. And it just ensures continuity for my consulting team as well as for the organization. And we've had contracts that go up to 5, 7 years. Typically, at the end of it, there's an opportunity for renewal. It just depends on does the organization still have the same needs? And here's the thing, our goal is not to have them on for 10 to 15 years unless they are growing and establishing new facilities. If it's a small organization, our whole goal is to position them so they're able to grow successfully moving forward, right? Give them the tools they need, help them get the right people in place, and then give them a plan strategically where they're able to sustain that type of efficiency moving forward.
Nice. Nice. When you think of your vision, when you
Mhm.
think over the next, let's say, 12 months, revenue wise, performance targets wise, what are you really aiming towards?
Oh, yeah. So our goal is always to double our profit
Okay.
each year. And we've had times where we've tripled it. And that if that happens, great. But we always aim to double what we had the previous year. Because I understand, or my vision is for growth and consistency. So it's not going too fast or growing too fast where we actually now don't have the capacity consultant wise. So when we are thinking about our marketing plan and our growth plan, we're strategically looking at making sure those things align as they move up. All right. The goal is always to move up and grow, but it's to make sure that there's consistency there. So you're not getting too far ahead on one side or the other. And now you find yourself where you have 75 clients, but you may not have the capacity as far as consultants to help meet those needs. So we always try to make sure that before we take a client on, we look at what our internal capacity is to ensure we can not only meet their needs today, but we can meet their needs 3 years from now, if that's what's needed.
Yeah, I like that. What do you feel like is the biggest challenge to expanding, scaling even further than you have already?
Yeah, I think it's just going to be honestly around more marketing. And because people will,
Yeah.
I'll get in front of a leader and he'll be like, oh my gosh, I needed this 5 years ago. And I'm like, we were around 5 years ago, but he didn't know it. So it's a matter
Fair
of,
enough.
of getting people to understand all the services that we offer because, and I can see where that may not have happened in the past because they may have heard about our great work with this nonprofit organization, and that may have been data management for that group. And so in their minds, oh, Avail does data management, not understanding that Avail also does grant review. Avail also does mobile notary services that we have in place. We also do curriculum development for universities and colleges. So ensuring that as these referrals are happening, they're sharing all of our services that we offer, not just the ones that they use, or giving us an opportunity to do that. So that's been a challenge for us, but we certainly have a plan to address that.
Awesome. What is the best way for people to reach out to you to work with you?
The best way is going to be to reach out to our email address, which is info@availmanagementservices.com, or they can call our 1-800 number, which is 1-800-562-3575. They can
Awesome.
also reach out to me directly, which is L Nicholson, Nicholson, @availmanagementservices.com.
Awesome. Beautiful. Any final words before we wrap up?
Yeah, I do. I want to share that something that I consistently share with my team and healthcare leaders that we meet is that currently we have clients across the US. And I think sometimes people think that we're strictly in Alabama. We service clients in all US states, and then we also service clients internationally. So seeing us stateside, I want healthcare leaders to know that regardless of where you are, our services still can be offered and of use to you. We continuously look at healthcare trends, public health trends, and a motto that I have for our team is we're adaptable. We bend, we don't break. Healthcare has its challenges and it is consistently evolving. And part of our goal is to remain innovative and to see what is happening, what is coming, and to be able to help these healthcare organizations be positioned for that. So at the end of a contract with us, the goal is for them to be able to have an overall patient engagement, increased patient satisfaction, as well as their internal team satisfaction, a healthy workflow that generates revenue as well as profit, and then understanding that any program that we are managing or working with for them is going to be successful. We put pride into attention to detail, follow up, data interpretation to ensure that we position these leaders and their organizations for nothing but greatness.
Awesome. I love that. Liza, thank you so much for your time.
Thank you as well for having me. Have a great day.
So that wraps up another insightful episode of Founders Future. To our listeners, if you enjoyed this episode, don't forget to reach out to Liza. She gave you her email address. You've got lnicholson@availmanagementservices.com. You've also got info@availmanagementservices.com. And while you're here, don't forget to subscribe to Founders Future wherever you listen to your favorite podcasts. And if you are a business owner, specifically a coach, consultant, or an agency, and you're really looking to scale your business and you want to enhance your sales and marketing efforts, visit closers.io to discover how we can support your growth journey. Until then, keep on climbing.